Hello, I'm Shelley Sidori, and I'm a registered nurse at Memory and Movement Charlotte. We have 4 cornerstones of care for every patient. We want our patients to always be calm, unhurried, and not worried, clean, physically cared for, safe, minimizing risks like falls, scams, or driving accidents, and loved, engaged in meaningful relationships. We're going to talk a little bit about safety here because for people living with cognition or movement problems, safety is a very real concern and there are common risks we can minimize. It is important to be vigilant for warning signs. A safety risk for everybody is medication. We are all guilty of missing a dose of a prescribed medication somewhere along the way. The stakes are higher, however, with drugs we often prescribe for our patients. Missing a dose or forgetting you took a dose and taking it again can be especially serious with medications for blood pressure, blood clotting, anxiety, depression, and agitation. We highly recommend that everyone use a weekly pill organizer. We also ask that all medications are brought to each appointment in the red bag you received at your first appointment. These 2 strategies help patients take medications consistently as prescribed and help us monitor what's being taken. Additionally, if your primary care physician makes any changes to medications, we ask that you send us a message or give us a call. We can provide excellent guidance around medication changes. Falls are another common safety concern. Age alone is a risk factor for falls. Roughly 35% of adults over the age of 70 fall each year. For those with a memory or movement disorder, the risk goes up. At every visit, we assess the way the patient walks and introduce strategies to prevent falls. These may include assistive devices like canes, walking sticks or walkers, physical therapy, or a home assessment to look for fall hazards. Many of our families have concerns about driving. Mishaps with driving occur when mobility inhibits the physical requirements for driving, or memory loss results in getting lost or forgetting road signs. Early warning signs include family members who become hesitant to ride with the driver or allow grandchildren to ride. Discussing driving and taking actions to ensure safety can be especially challenging, but are of course very necessary. Driving assessments, both simulated and on road, can be used to help determine safety. Firearms in the home, using a stove, risk of wandering, and having unlimited access to finances are additional safety risks. We review and discuss these at each appointment with the patients and the caregivers. Like medications, falls, and driving, the key is early recognition of safety risks and intervention before a problem occurs. Even with the best laid plans, safety problems can still arise. The MMC staff are well trained in handling safety issues and are always available to discuss any concerns you have.
Hi, I'm Robin Wolkowski, a physician assistant at Memory and Movement Charlotte. Let's talk about caregiving. For those who are caring for a loved one with a progressive memory or movement disorder, the primary caregiver role can be unexpected. For a few minutes, I'm going to talk to the caregivers. At every visit to MMC, we will check in with you as well as the patient. You both need time to express not only the physical aspects of the memory or movement disorder, but also the impact on the emotions and mental health of everyone involved. If other members of your family's care team would like to come to appointments, we welcome them too. We really are in this together. Let's talk about caregiver stress and a few things that may help. It's important to acknowledge and manage the stress that comes with helping your loved one. There's a lot to stress about. Everyday errands and tasks can take longer and are harder to do. Plans and expectations have changed, and social life may be more limited. All of these changes can bring feelings of anger, sadness, and loneliness. The risk of depression, anxiety, and chronic conditions in caregivers is very real. There's actually a name for this: caregiver stress syndrome. Feeling like you're not alone can make all the difference. Often friends and family want to help, but they need an assignment. Give them one. Picking up groceries, taking the patient out to lunch or for a haircut, helping with housekeeping or laundry. Even out-of-town connections can help with things like bill paying, ordering groceries online, and virtual visits. When someone offers to help, it's really okay to accept and delegate. Think of ways close friends and family can help day-to-day life run more smoothly, and how you can work together to maintain independence and dignity for your loved one. Most people try to avoid uncomfortable conversations, but this isn't a time to avoid your support network. It's a time to come closer. Coming closer is an ongoing process that evolves over time. Having realistic expectations as changes occur is a key to managing the stress inherent in caregiving. Your MMC team may also suggest a care plan visit, a 1-hour appointment just for caregivers with a clinician and a social worker. Topics include diagnosis and treatment, main concerns and goals, strategies for safety, behavior, communication, and caregiver stress. We will connect you with resources as you need them. Remember, you've got this, and we've got you.
From the beginning, education has been a cornerstone of our practice. Take Charge is the umbrella name for Memory and Movement Charlotte's educational initiatives. The program was born of our philosophy that through support and education, caregivers can be empowered to take charge of this journey. Our goal is to enable you to approach each situation more objectively, less emotionally, and provide concrete tools and strategies to navigate the journey with confidence. There are 4 core components.
The first is the Take Charge binder. This is a tool you can use to stay organized. One section contains instructions about how to use our patient portal, an important communication tool you can use to contact our office and your loved one's medical team easily. Another is the crisis plan. We hope you'll never need this, but it is possible that you, the caregiver, will have some kind of emergency and have to take time to care for yourself. We want you to be able to do this without worrying about what is happening to your loved one in your absence, so we make a plan just in case. This plan addresses who can be available in the immediate aftermath of an emergency, who can be available for the short term, days or weeks, and if there's a long-term need, to know the options. There are also sections for medical information, contacts, and clinical instructions. We ask you to bring the binder to every single appointment, and we'll add information over time, making it a personalized, interactive tool. The second component is a red medication bag you can use to carry your bottles of medication to every appointment. By seeing and reviewing all of your medications, prescription and over-the-counter, we can avoid medication errors.
The third piece of Take Charge is access to educational resources on our website. One of the drivers for the Take Charge program was to provide a curated collection of information to be accessible 24/7. The Take Charge online resource library contains videos and handouts arranged into useful categories for viewing and printing. We continue to add to this library and update the information there. You can find the library under Education at the top of our website, and we encourage you to explore this resource and share it with others on your care team.
The final core component is a series of programs we call Take Charge Live. These are monthly conversations hosted by the MMC team on topics of interest to patients and caregivers. You can attend in person or participate virtually, and recordings of past sessions are available on our website. If you're on our mailing list, you'll be notified of upcoming sessions, and we hope to see you there.
We firmly believe that caregivers need to be prepared, educated, and empowered.
And that's the way we help you take charge.